Hello all, welcome to this video on replicated case note discussion. Now in today's video we're going to analyze a case note which is a replicated version from the most recent OET exam held on 10th May 2025. Now the general feedback obtained from the students regarding this letter writing was, it was okay, not that complicated, but still there were some areas of confusion. So through this video we're going to analyze and understand what are these areas of confusion and what should have been done by the students. So let's get straight into the video. Now you can see the case note on screen. This is the first page, but we know that during 5 minutes of reading time, out of the 45 minutes, initially we have 5 minutes to read the case note. So during that 5 minutes of reading time, we first understand what our role is. You are a COPD nurse who performs monthly checkups. So you are a COPD nurse who performs monthly checkups means you get an idea that your patient is somebody who has COPD. And then straight away we move on to the last part, that is to understand what the writing task is. Why do we go to the writing task straight away? Because we want to know who the reader is and what is the reason for writing the letter. Why? When we know who the reader is and what is the purpose of writing the letter, we are in better control to select what kind of data are to be included into the letter from the case note. Okay, so let's see who the reader is. Now the writing task says, using the information given in the case note, write a letter to the manager of smoking cessation clinic. That was kind of interesting to many because this was one thing that I felt which was quite different from the usual pattern that we get. Mostly we get letters wherein the reader would be a medical person. Now here, manager of smoking cessation clinic means we have to keep that idea in mind that manager of smoking cessation clinic would definitely be a non-medical person. Non-medical as in, of course, he or she would be somebody associated with healthcare, but not a completely medical person like a doctor or a nurse. So that idea we have to keep in mind. Why should we keep that idea in mind? For the main reason is that when we consider the aspect genre and style, we should be careful not to use too many medical jargons in our letter because we have to craft or we have to draft our letter in such a way that it is understandable to the reader. So keep this idea in mind. Our reader is a non-medical person. Manager of smoking cessation clinic. Now describing patient details. So what are the aspects that we have to include in our letter? Patient details should be then medical history and the reason for referral. Of course, patient details will be including, the relevant patient details are to be included in the letter. Now despite being a non-medical person, here the writing task says that you have to include the medical history here. So why it would have been mentioned like that in the writing task? So one probable reason is that the current condition of the patient might be associated with the current condition of the patient for which we are seeking help to this manager of smoking cessation clinic will be having an impact on the medical condition of the patient. Initially when we read the first line, what did it say? What was our role? You are a COPD nurse. So we can relate now, COPD. So the patient has COPD and you're referring the patient to a smoking cessation clinic means maybe the patient is not able to come out of this smoking habit. This is somebody who has smoking habit and it is impacting this condition COPD. But let's not go for assumptions, but still we can actually get ourselves prepared for such situations by connecting the ideas. So the main things that we have to understand from the writing task is that first, the reader, manager of a smoking cessation clinic, not a completely medical person, and the kind of details that we have to include in the letter, or what is the reason. It is a referral letter. The type of letter is referral, that we understood. The type of letter, it's a referral letter, and the reason is here it is mentioned that you have to include the patient details and medical history. What are to be included is given here. Now after reading the writing task, then the next part that we look is the plan. From the plan we get a better understanding on the purpose of writing the letter or the reason for writing the letter. Here 2 points are given in the plan. One is referral to smoking cessation clinic and the other one is COPD management. Of course we understand that COPD management, it's not something relevant or it's irrelevant to the manager of smoking cessation clinic, this is irrelevant. So this is not our concern for this letter. This letter, COPD management, is irrelevant. So the reason why we are writing the letter is for smoking cessation. Now we got an understanding as to why we are writing this letter for smoking cessation, to help the patient assist with smoking cessation. Keeping this idea in mind, now let's go through the case note and select the data. Let's get back to the first part of the case note. This we already read. You are a COPD nurse who performs monthly checkup for Mrs. Barlow. Now, what are the details that are to be included? Now we have today's date. Of course, we have to include today's date because that is the date with which we start writing our letter. Then patient details, name, age, both are relevant. If date of birth was given, then we would be considering date of birth. If date of birth is not given, then we'll consider age. If both are given, let's go for date of birth because that is more accurate. Then medical history. Medical history, in the writing task it is mentioned that to include medical history, it is given in the writing task. But you have to keep in mind who your reader is. Manager of smoking cessation clinic. So only consider those details from medical history which would be contributing towards the management of the current condition of the patient. Nothing like anything which is even remotely connected to that should not be there in the letter. Now osteoarthritis, and the patient is on NSAIDs, it is irrelevant, don't consider that. Chest infection 2022. Now chest infection, breathing related problem, that can be considered as a semi-relevant detail. Should we be including it or should we be excluding it? We'll decide it at the end. Then COPD, May 2023, it was diagnosed in May 2023 and regular monthly checkup. Of course, that we have to mention. COPD is the main medical condition here because we are the COPD nurse and our association with the patient is through this COPD management or checkup, regular checkups or follow-up for COPD. Then inhalers, salmeterol, salbutamol combined with corticosteroids, 2 puffs daily. Do we need to consider that? No. These, you should never be including the names of these medications to the manager of the smoking cessation center because the smoking cessation clinic manager has nothing to do by knowing the names of these medications. Of course, maybe you can just update him that he is on medication or he's on some kind of the patient, not he, sorry, she. It's a female, Mrs. Gillian Barlow. So this patient is on some kind of management or medications for COPD, but you don't have to list out the names because the reader is not a medical person. So like telling him something, telling to the reader something which he has no idea about, it's actually confusing the reader. So you should never be doing that. So you can maybe just say that the patient is on inhalers or on medication, but you should not be including the names of the medications. You should not be including. It's not like you need not include. Even if you include it is okay. No, don't consider it in that way. When it comes to genre and style assessment criterion, it's very clearly mentioned that like you have to consider or you have to develop the letter in a way which is understandable to the reader. Using any language or terms which the reader cannot understand will actually decrease your score. So please don't mention these names. Then moving on to social history. Now in social history, widow and lives alone can be considered. Yes. Retired retail officer, that professional background, retired retail officer has nothing to do with the kind of management what the manager of the clinic, smoking cessation clinic would be providing. So that is irrelevant. Then 2 children both abroad, okay, you may consider that. Then smoker 20 cigarettes per day, of course that is very, very relevant. Drinks 30 units weekly, it's not very relevant, but like since you are referring to a cessation clinic, maybe you can update that this person has another addiction as well. So as a semi-relevant detail, we can consider this as well. Now moving on to the dates, the first date that you see is 4th May 2024. Dizziness, cough, breathlessness, these were the presenting complaints, inability to walk, chest infection confirmed. Now, do we have to list out the symptoms? Are we referring the patient to a doctor or a respiratory specialist for further management? No. So by knowing these initial symptoms, the reader is not, our reader as per this letter is not going to gain anything out of it. So you can actually avoid them. They are not required. Maybe we can say it in a very simplified way by saying that the patient presented with breathing related issues or breathing difficulties and chest infection was confirmed. That is enough. Then reduced smoking to 15 cigarettes. So that is an important point. Like usually the patient used to smoke 20 cigarettes per day, but now as of now it is only 15 cigarettes. Still unable to quit. So the patient is like, despite the fact that the patient has been diagnosed with or was diagnosed with COPD, the patient is still not able to come out of that habit or completely quit that habit. She was able to reduce it from 20 cigarettes to 15 cigarettes. So this aspect is relevant to the smoking cessation clinic manager. You can say, or you should be saying, that the number of cigarettes that the patient smokes has reduced to 15 from 20, but still has not got over it completely. Then another aspect that you should be careful, okay, that I'll say during sentence construction, let's not consider it now. So this is relevant. Then recommended nicotine patches. Of course, this is something, a management that you recommended, or that not you, as in the writer recommended or suggested as part of quitting or for ceasing this smoking habit. So definitely that is relevant. Educated on importance of smoking cessation. That is also relevant. Now these are the happenings that you would be definitely including from the date 4th May. That there was chest infection, then the cigarettes, number of cigarettes, like now it is 15, that should be conveyed. The nicotine patches advised and educated on smoking cessation. Okay. Now the next date, 5th May, chest infection reduced. Okay, you can say that. Then shortness of breath, unable to walk more than 100 meters without rest. So like even though chest infection reduced, she still experiences shortness of breath. So that can also be considered. I wouldn't say it is very relevant, as a semi-relevant detail. That is because in the writing task it says to talk about the medical history of the patient. So COPD itself is the main medical issue. Now the shortness of breath, it's all associated with that. So it's not very necessary that you have to list out all the medical conditions or the problems that the patient is going through as of now. Then complained about inability to quit smoking, continues to smoke. That is, the patient is still on smoking. Okay. You can consider this, or you should be considering this, but still make sure that there is no, without repetition, you have to put in this idea. Don't repeat this without repetition. Try to include this. When you have similar ideas under 2 different dates, make sure that to achieve conciseness, that is another important criterion, conciseness and clarity. So what is the one aspect that they say in conciseness and clarity is you should be able to effectively summarize the details. So as part of summarizing, what you have to do, the first thing that you can do is that when the same detail is being mentioned under different dates, you should not be repeating the same in the same manner in your letter. You should summarize and write. Then nicotine patches ineffective. Okay, this is relevant. Breathing exercise taught, physiotherapy initiated. It's not relevant to the smoking cessation clinic manager. But still, maybe as a writer's concern, if you want to say that what we have done from our end, because we noticed the breathing related issues from our facility, as a semi-relevant, if you want, you may consider that. That's it. But it's not a relevant detail to the smoking cessation manager. Nicotine gums recommended. Yes, of course it is relevant because it is associated, it's directly connected with smoking cessation. Maybe these two again you can connect and say. Now we shall see, yes, one more date, that is today's date is there. Compliant with breathing exercise and physiotherapy. There's no need to say such things to the smoking cessation manager. If at all you are mentioning about breathing exercise and physiotherapy, just mention it at one place. You should not repeat it under 5th May and 6th May. The detail should not appear repeating because it has not got any importance or significance to the reader. The plan we have already selected. COPD management is not required by the reader. Now that we have selected the relevant data, the next step before we start writing the letter is how to organize the details. Now, when it comes to organization, of course, we'll be first starting off with the purpose paragraph. Then after purpose paragraph, what next? we have different categories. We have details from different categories. We have from social background, we have from medical history, and a few dates. So what we'll start off with. Now, the reader being a non-medical person, the director of a smoking cessation clinic, what I would recommend is that you can go with the social background. You can start with the social background, and then that is more important to the reader, his background and his smoking related habits. Then you can say the medical condition which is actually caused or which is actually being worsened because of this habit. So you can detail about the medical aspects. Okay, and along with the medical aspects, you can mention about like how you have advised, how from your facility you have recommended the management for smoking cessation, and how the patient is not able to follow his non-compliance with all those strategies can be mentioned along with this when you're detailing the medical aspects. And then finally you can come to the recommendation. Okay. Now this is just one way in which you can organize it. If you have good control of the language, and if you're able to present it as a good story in whatever way you start it, it's fine. The only thing is that the lesser important details should not be highlighted in the initial paragraphs. That is, if you're starting off the paragraphs by completely talking about the medical history and medical background, you're completely talking about that, and towards the end you're talking about the smoking habit, means that doesn't make sense, because the reader will be more interested in knowing about the smoking habit of the patient. Okay, so this is one way in which you can organize the letter. Now, regarding the purpose paragraph, we know that while drafting the purpose paragraph, we have to include who the patient is. Of course, we know Mrs. Barlow, and then what is the current problem of the patient and what the patient requires from the reader. Now, the current problem of the patient is that the patient is unable to quit smoking. She has a very excessive or well established smoking habit, and she's not able to get out of that. And another problem, this is the main problem. Okay, and since the writing task says that like you should be including the medical history, of course you have to mention that in the body. Whether to include that in the purpose paragraph or not, it's optional. Now, if you want, you can say that she has the smoking habit which is actually affecting her health. So that also you can include in the purpose paragraph, because my concern, being the nurse who's providing management, COPD management to my patient, my concern is that my patient's COPD condition is getting worse because of this smoking habit. So if needed, you can mention that as well in the purpose paragraph, but the focus should always be on smoking habit and smoking cessation, and the requirement is smoking cessation. So in simple terms, the reason for writing the letter is that you are referring the patient to the smoking cessation clinic for smoking cessation. That's as simple as that. Now I'll show you a sample letter. Here is the purpose. I'm writing to refer. So you have mentioned the type of letter. I'm writing to refer Mrs. Gillian Barlow, who has a habit of substantial smoking. See, now why I've included substantial smoking is that we doesn't know like when the patient has started this smoking habit. Now, if we know if the patient has had this habit for maybe around 20 or 30 years, we can also say that who has this long-standing habit of smoking. But since we are not very sure from the case note when the smoking habit started, the only fact that we are left out with is that the patient had been smoking 20 cigarettes and recently it has now been cut down into 15, which means that she smokes excessively. The number is high. But because of that reason, can we say that who is a chronic smoker? Chronic smoker? Can we say that? No. That becomes judgmental. So make sure that you don't use such terms in the letter. Okay, so but instead you can put it in some other way to show the magnitude of it, but in a very non-judgmental way. So that is the reason why I have mentioned substantial or considerable or significant smoking habit and history of respiratory complications. Now this and history of respiratory complications, it's just optional, okay? It's not necessary that you have to mention it in the purpose paragraph. The main focus is, of course, this substantial smoking habit, and definitely you have to mention the requirement. She requires support from your center to assist with smoking cessation. Clear? Okay. Now, in simple, you can make this purpose paragraph very simple by saying that this is to refer Mrs. Gillian Barlow for smoking to assist with smoking cessation. It is clear that way also. There's nothing much, there's no medical condition to be highlighted there. When you're writing to the reader of a smoking cessation clinic, there'll be no other purpose other than helping the patient with smoking cessation. Now, how to help with the patient? Now, another thing that you have to be careful is please don't include ideas which are not given in the case note. For instance, please provide counseling sessions to help the patient overcome the smoking habit. No, please don't introduce new ideas unless and otherwise if it is not mentioned in the case note or in the plan that counseling sessions or diversion therapy, if it is mentioned, of course you can include the same in the letter, but other than that, please stay away from including such terms. You should not be assuming things, no assumptions, okay? You should be not assuming things, no assumptions when you write the letter. Only what is given in the case note, you transform it into sentence, grammatically write sentences and write the letter, that's it. Then another thing what I would like to include or mention here is that please don't use the word addiction as well. Somebody who's addicted to smoking, that is again judgmental. So you just follow a very non-judgmental approach. Then after the purpose paragraph, Mrs. Barlow, like here as I've mentioned earlier, I've started off with the social background. Ms. Barlow is a widow and lives alone as her children live abroad. She currently, now this is another area that students could probably make mistake when it comes to the grammatical aspect, okay? Because the patient was consuming 20 cigarettes and now it has come down to 15 cigarettes. So don't say that she consumes 20 cigarettes daily. No, because as of now she is not consuming 20 cigarettes. It was 20 and now it is 15. So you have to adjust your grammar accordingly. See, just see how the sentence construction is here. She currently smokes 15 cigarettes. So that's right, smokes, simple present sentence, because as of now it is 15. A recent decrease from her earlier intake of 20 per day. So you have connected that there. Earlier it was 20 and now it is 15. Then another thing, please don't use the word consumes when it comes to smoking. Don't say she consumes 15 cigarettes. No. For alcohol intake, of course, you can say she consumes, but cigarettes, please don't say consumes. Then additionally, she consumes 30 units of alcohol weekly. This is actually semi-relevant. If needed, you may consider. That's it. Then you're getting into this current, the recent problems. This part highlight the recent medical events. Okay. Now, Mrs. Barlow, you are giving an intro to that. What is the medical background of the patient? Okay. Mrs. Barlow is being managed for COPD, chronic obstructive pulmonary disease, with regular medication. See, you should just be mentioning regular medications. Don't mention the names of the inhalers, and attends monthly reviews at our facility. You are starting the storyline as to how you got or what is your association with the patient. How do you know the patient? Then on 4th May 2024, she presented with breathing difficulties, not elaborated the symptoms, and was diagnosed with chest infection. Okay. She expressed difficulty in quitting smoking, for which nicotine patches were recommended. Okay, it is associated with smoking cessation, so we have placed in there, and was educated on smoking cessation. Okay, although the infection improved by the next day, you've just made it clear on the medical side how was the progress of the patient. By the next day, she has shortness of breath. Then nicotine gum was subsequently advised due to inefficacy of nicotine patches. You said that nicotine patches was initially advised, but still as that didn't work, then now you have advised nicotine gum. That is only this much you need to include in the letter. Then finally coming to the recommendation to wind up the letter, considering Mrs. Barlow's ongoing smoking pattern, then health condition and limited success with initial cessation methods, your support in providing structured cessation assistance and further guidance would greatly be appreciated. See, you don't have extra ideas in the plan to develop the recommendation paragraph. So again, even in the recommendation paragraph, please be careful not to introduce your own ideas. Don't go for assumptions. Here also don't say that kindly arrange counseling sessions to help her overcome the smoking habit. No, counseling sessions, a word as such is not mentioned anywhere in the case notes. So please don't go for such sentence constructions or don't include such ideas in your letter. Here we have we have extended the recommendation paragraph, how by again taking ideas which are very clearly given in the case note. Considering Mrs. Barlow's ongoing smoking habit, yes, she's not able to get over that habit. So yes, because of that and health condition, she still has shortness of breath, all those problems, plus COPD is there. So that also you have included. And limited success with initial cessation methods. That is, we have tried nicotine patches, then we have gone with nicotine gum. So all those are not being successful. Because of these circumstances, you are seeking the help of the reader. You are making it clear to the reader that because of all this, please provide a structured approach with smoking cessation. Okay, I hope that is clear. Now, the area which students might have found confusing was like, to what extent we have to include this medical aspects, or like how should we be organizing it. These were the areas that the students found it confusing. Other than that, like, I feel that it's a very straightforward case note. So with that, we have come to the end of today's discussion. We'll be back with more such videos. Hope this was helpful. Stay tuned and thank you.
Medcity International Academy. Trusted hands forever.